Welcome all. Today we are diving into the examination of biopsy and morbid material for laboratory diagnosis. This is a crucial step where pathologists analyze tissue and cellular changes to uncover what is causing disease. By looking at biopsies or necropsy samples, we can spot inflammation, infections or tumors, and these findings help guide accurate diagnosis and treatment decisions. In short, careful evaluation of tissue samples is the key to linking clinical signs with microscopic evidence, giving us a clear picture of the disease process. First, we will discuss about biopsy. A biopsy is a medical procedure in which a small piece of tissue or a sample of cells is removed from the living body for detailed analysis in a laboratory. It is one of the key methods used to diagnose disease accurately. The term biopsy comes from the Greek word bios meaning life and opsis meaning a sight, literally a glimpse of life. This procedure allows doctors to closely examine tissues and cells, providing crucial insight into patient's health. Depending on the purpose, a biopsy can be excisional or incisional. An excisional biopsy involves surgically removing an entire lump or targeted area, allowing complete examination of the tissue. In contrast, in an incisional biopsy, also called core biopsy, involves taking only a small sample of tissue for analysis rather than removing the whole lesion as in excisional biopsy. Biopsies are used for a variety of diagnostic purposes. They can determine whether a lump or swelling is cancerous, help diagnose peptic ulcers, and identify disease affecting various internal organs, especially liver. Biopsies also help in identifying the type of infection, whether it is bacterial, whether it is fungal, and also the nature of inflammation, providing essential information for accurate treatment. Cytology involves the examination of cells collected from tissues or fluids. The result of cytology can generally fall into three categories. It can be either inflammatory, neoplastic, or cystic. Inflammatory results indicate the presence of infections or irritation, and neoplastic results suggest abnormal or cancerous cell growth, and the cystic result indicate the presence of a fluid-filled sac or cavity. First type is inflammatory. In that we will learn about separative inflammation. In this case, the sample containing large number of neutrophils. As you can see in this picture, all these cells are neutrophils. The neutrophils can be non-degenerative or degenerative. If the neutrophils are non-degenerate, it may indicate an immune-mediated condition or due to sterile irritants or even neoplastic lesions. If the neutrophils are degenerate, it usually suggests a bacterial infection or sepsis. Here you can see some group of cocci. How we will distinguish between these non-degenerate neutrophils and the degenerate neutrophils? The non-degenerate neutrophils are normal appearing cells with a dense clumped nuclear chromatin. The nuclei are regular in shape, either segmented or band, and the cytoplasm is clear to light blue. These cells are usually seen in non-infectious inflammation or mild tissue responses, and importantly, their nuclear structures are preserved. In contrast, in the second picture, you can see degenerate neutrophil showing nuclear swelling, pale or fragmented chromatin, and sometimes karyolysis also, where the nuclear material begin to dissolve. The cytoplasms may appear vacuolated, and these changes are commonly associated with bacterial infections or toxic inflammatory environment. In summary, non-degenerate neutrophils indicate a normal inflammatory response, while degenerate neutrophils point towards toxic or infectious process, helping guide clinical interpretation on cytology. The second type is histiocytic or macrophagic inflammation. Here the macrophage are the predominant cells and multinucleate forms may also be present. This pattern is commonly seen in response to foreign bodies or fungal infections or specific bacterial infections like Mycobacterium nocardia or Actinomyces species. And the third type is mixed inflammation, where we can see different cell population. We can see neutrophils, macrophages, lymphocytes and plasma cells are present together. This is typically seen in the case of chronic tissue injuries such as lip granuloma, reaction to foreign bodies, fungi and bacteria. The fourth type is eosinophilic inflammation, characterized by more than 10 to 20% cells will be eosinophils. This pattern is commonly seen in hypersensitivity or allergic conditions, parasitic infection, some fungal infections and some neoplastic processes such as mast cell tumors. And the last type of inflammatory condition is lymphocytic or lymphoplasmocytic inflammation. This consisting of heterogeneous mix of mostly small lymphocyte along with the plasma cells and other inflammatory cells. It is typically observed during antigenic or immune stimulation, early viral infections or chronic inflammation. Next we will learn about neoplastic cytology. It is characterized by the presence of atypical cell population, especially when there is little or no accompanying inflammatory response. That's the important thing we have to look, which type of cell population is predominant. Usually in the neoplastic condition, there will be little or no inflammatory response. A monomorphic population of cells in an unusual location or cells displaying highly atypical morphology with multiple criteria of malignancy may suggest a neoplastic process. Neoplastic process can be further classified into 4 general tumor categories. That is, it can be either epithelial, mesenchymal or discrete or round cell type and the naked nuclear neoplasms. When evaluating neoplastic cells, certain criteria will indicate whether it is malignant or benign. So, for categorizing into malignancy, we have to look for certain features. These include, first one is anisocytosis, which indicate variation in cell size. Here in this picture, you can see all the cells are of variable size. In the normal tissue, all the cells are usually of same size. Next is anisokaryosis, which means variation in the nuclear size. Varying nuclear cytoplasmic ratio, that usually indicate immature cells because the cells are rapidly multiplying. And presence of multiple nuclei, here you can see multiple nuclei in a single cell. Usually cells have only a single nuclei. Then prominent or multiple nucleoli, that indicate the cells are actively dividing. You can see nucleoli, whatever nucleoli presents are prominent and most of the cells having multiple nucleoli. And there is nuclear molding. Macrocytosis means abnormally large cells and abnormally large nucleus. The neoplastic cells we can broadly classified into epithelial, mesenchymal, round cell or the other group, that is a naked cell group. First we will talk about the epithelial neoplasm. In epithelial neoplasms like adenomas or carcinoma, they are typically arranged as cohesive clusters. So the cells will be seen as a sheets rather than as a individual cells as in the case of mesenchymal tumors. When the cells have a glandular origin, as in the case of adenocarcinoma, we can see the acina formation that we can see in the normal gland also. And these cells exhibit certain features. So if you want to classify the cytological sample into the epithelium, they have to show certain features. First one is the cells should be large, round or polygonal shape, and it will have a distinct cell borders and tightly adhere to each other, often with a visible tight junctions. The nuclei can be either round or it can be oval in shape. And examples for the epithelial neoplasms include perianal adenoma, transitional cell carcinoma and bronchoalveolar carcinoma. The second group is mesenchymal neoplasms, commonly referred to as sarcomas. Typically consist of individualized cells often associated with the extracellular matrix. Actually, these type of tumors do not exfoliate well, so the aspirate will have a very low cellularity, which may make the definitive cytological diagnosis challenging. The cells will exhibit certain features, then only it can be classified into mesenchymal tumors. The first feature is the cell should be spindle, oval or stellate shape, and the cells will have a indistinct cell borders, but in the case of epithelium it have a distinct cell borders, and it will be scattered individually and often in a very low numbers. In the case of epithelium it will seen as a sheet of cells and there will be large number of cells, but in the case of mesenchymal tumor we will get a very less cell population and they will be associated with the extracellular matrix. The nucleus can be either round or oval. An example for mesenchymal neoplasm include fibrosarcomas, osteosarcoma, chondrosarcomas. Here you can see a case of lipoma. The round cell tumors consist of individualized round cells that tend to exfoliate readily, resulting in high cellularity in cytological samples. There are 5 main types of round cell tumors, each with a distinct characteristic which can be identified through careful cytological examination. So first type of round cell tumor is mast cell tumor. How we will identify these? These are a type of round cell neoplasm. It's commonly seen in dogs and cats. On cytology, they are characterized by individualized round cells that containing numerous purple cytoplasmic granules which may obscure the nucleus. So because of the presence of these purple color granules, the nucleus will not be clearly visible. And these granules contain histamine and other bioactive substances. And the nucleus are typically round to oval and the cytoplasm is moderate in amount. Mast cells may appear in clusters or individually, and there can be variable inflammatory background, often with eosinophil. Eosinophil is a common feature in the case of mast cell tumors. Sometimes neutrophil also we can see. Careful examination of the granules and cellular morphology help in the accurate diagnosis of the mast cell tumors, which is crucial for determining prognosis and guiding treatment. It is important to note that with diffuse staining, the granules sometimes appear less prominent or pale, which can make diagnosis challenging. So attention to cell morphology is important if you are doing staining with the diffuse staining. Next, let's look at the cytology of histiocytoma, a common benign skin tumor in young dogs. So, histiocytoma usually seen in young dogs. These cells have variable distinct cell borders. The nucleus will be round to oval, sometimes show mild indentation. That is one of an important distinguishing feature. And the cytoplasm is moderate to abundant, appearing clear to light blue on routine stains. Overall, histiocytomas exhibit minimal cellular atypia with uniform cell size and a very bland consistent morphology, features that help distinguish them from malignant round cell tumors. A characteristic finding is the presence of small lymphocytes infiltrating the sample. These represent tumor infiltrating cytotoxic T cell, a hallmark of the immune response that often lead to spontaneous regression of these lesions. Let's break down the cytology of plasmacytoma. It's another type of round cell tumor. It's a neoplastic proliferation of the plasma cells. These cells shows a distinct cell borders and have a deep blue basophilic cytoplasm, sometimes mixed with a lighter zone. A classic feature is the perinuclear clearing. Actually, these represent the Golgi apparatus. The nuclei are round to oval and it is eccentrically placed. See, in this you can see the nucleus is eccentrically placed. A clear perinuclear clearing you can see. You will also notice binucleation or multinucleation. Binucleation is a feature of plasma cell tumor which help confirm the neoplastic process. Altogether, these features like deep blue cytoplasm, Golgi clearing, eccentric nuclei, frequent binucleation strongly suggest a cytological diagnosis of plasmacytoma. Next, let's review the cytological feature of cutaneous lymphomas. On aspirates, we typically see a monomorphic population of lymphocytes, means the cells look very similar to each other. Depending on the type, they can be either small, intermediate or large in size. The cytoplasm is usually scant and light to mid blue, and the nuclei may contain variably prominent nucleoli, especially in the case of intermediate and large cell lymphomas. Two main types are important clinically. First one is epitheliotropic lymphoma. In the case of epitheliotropic lymphoma, which is usually of T cell origin, shows epidermal and adnexal involvement, including infiltration of hair follicles and mucocutaneous junction. In contrast, non-epitheliotropic lymphoma, that is of B cell origin, tend to involve the dermis and subcutaneous tissues without epidermal infiltration. Together, these features help guide the diagnosis and classification of lymphoma on cytology and histopathology. The last and the most common type of round cell tumor is TVT or transmissible venereal tumor. Although TVT originates from the histiocytic lineage, the neoplastic cells carry an abnormal karyotype, reflecting their unique transmissible nature. On cytology, we typically see a monomorphic populations of round cell, and the nucleus are round and coarse chromatin with a very prominent nucleoli. That's a very important feature, giving them a distinctly malignant appearance. The cytoplasm is abundant and in the presence of multiple cytoplasmic vacuolation, punctuate cytoplasmic vacuolation, which are often numerous across the samples. The mitotic figures are also common, highlighting the high proliferative activity of this neoplasm. These features, the round cells with a coarse chromatin, prominent nucleoli, cytoplasmic vacuolation and frequent mitosis, are characteristic of TVT and help distinguish it from other round cell tumors. Next, we will discuss naked nuclear neoplasm, a distinct group of tumors most commonly of endocrine or neuroendocrine origin. On cytology, these tumors often exfoliate in large numbers, but the cells are fragile, resulting in aspirates that contain many bare nuclei from the ruptured cells. Intact cells, when present, are usually seen as loosely attached sheets or packets surrounded by numerous bare nuclei. The individual cells are typically round to polygonal cells with the indistinct cell borders, and often very few cytological criteria of malignancy are seen despite an aggressive biological behavior. So we have to be very careful. And the examples for these type of tumors include thyroid tumors, pancreatic islet cell tumors and paragangliomas. Recognizing the presence of numerous bare nuclei and fragile cells is key to identifying this group on cytology.